Good day, I'm Dr. Dale Dangleben, back to the regular programming of Patient Choice in Chemin, Neuf, Pointe, Michel. This week I want to talk about electrolytes, sodium, potassium, phosphates, and things like that. And you both the up and down, right? Hypo and hyper. But today I want to start talking about hyperkalemia, which is high potassium. Right, hyperkalemia, and again, if this is a new term to you, take note, okay? But it just means high potassium, right? Potassium concentration is greater than 5 millimoles per liter. They don't give you the units, but if they say 5, above that is high, right? Potassium is very important for a lot of things: heart rhythm, muscle function, right? Nerve conduction. So if it's low or too high, then it has to be managed. Okay. Hyperkalemia can occur. Think of it as two ways, right? Too much potassium entering the blood, or the body failing to eliminate potassium effectively. And that's usually found mostly in kidney-related issues. Chronic kidney disease, right, develops the impaired ability to excrete potassium, so you can't get potassium out, right? Even acute kidney injury, which is just sudden drop in the filtration, you can have that. And then there's a couple other adrenal and renal kidney issues that can lower your potassium excretion, but we're not going to get into that. Then there is medication-induced. Some of the diuretics, specifically when they say potassium sparing, right? So spironolactone, trimethamine, and a couple others are potassium-sparing diuretics. Your physician needs to explain that to you. The ACE inhibitors that I talked about, the linaprazole, the lisinopril, right? The ARBs, the angiotensin receptor blockers, losartan, valsartan, etc. All this can cause medication-induced hyperkalemia. All right? So there's a lot of things, going down. Like if you have tissue breakdown, like your muscles, something called rhabdo. If you have a severe trauma, the potassium in the cells will leak out, okay? And even patients with insulin deficiency, patients who take the beta blockers, etc., all these things affect, potassium, okay? And then if you're just obsessed and you're taking excessive, and this is very rare, by the way, if your kidneys are working, that you're taking in too much potassium-rich foods, okay? The potassium-rich foods are only affected concerning when you have kidney disease, right? And potassium is so vital to the function of the heart. Too much of it disrupts, right? And you get arrhythmias, all right? And there's a whole bunch of things that you could see on your EKG that we're not going to get into that. That's for the physicians who know what to look for on the ECG or EKG, right? So hyperkalemia destabilizes the heart. So you need to monitor the heart by ECG, all right? So again, it's important to know, how do you treat? You want to stabilize the heart immediately, and usually we give calcium. You got to give IV calcium to stabilize the cardiac membrane in hyperkalemia. All right? You want to shift potassium into the cell. That's a temporary fix. So you give insulin and glucose, right? That shifts the potassium, and it's temporary. You can also give albuterol nebulizer, which is a beta agonist. All right, and a couple other things. Or you could just remove potassium from the body. You can do that with loop diuretics such as Lasix, which is a water pill. You can give Kxalate, which is like sodium polystyrene sulfonate. All right, and there's newer ones out there now They're very effective. They bind potassium in the gut, prevent it from being absorbed, so you pass it. All right. And last but not least, which is the most effective and rapid way of removing potassium from the body, is hemodialysis. Hemodialysis. All right. So that's really an update on hyperkalemia. It's you got to pay attention to that. I want to just end by going through some of the foods that are high in potassium. Right. So if your potassium is levels are high, you have kidney issues, and your potassium is not coming down effectively. These are some of the foods. And again, you might say, well, it's counterintuitive, but you know what? You got to pay attention to your condition. Bananas, oranges, cantaloupe, apricot, prunes, potatoes, tomatoes, spinach, even avocado, sweet potato, pumpkin, right? All these things are rich in potassium. So the safer alternatives to all of this, you could have apple, berries, grapes, cucumbers, lettuce, rice, right? Are lower in potassium. All right, so pay attention to labels, read what's on the box or on the can or whatever you eat in, less processed foods, period. But I want to end with this. The takeaway here is hyperkalemia is a medical emergency, okay? And it arises when your kidneys are not functioning well, all right? And your heart is the most vulnerable organ, right? So you could have a potential fatal arrhythmia, heart attack, all right? So again, you want to stabilize the heart. You want to shift potassium around, and then remove it from the body. Dietary potassium restriction is important for patients with chronic kidney disease, or if you continue to have hyperkalemia that's uncontrollable. There's a lot more to this topic that we can get into, but I just wanted to give a brief update on high potassium, known as hyperkalemia. Tomorrow, we'll tackle another electrolyte. Have a great day. I'm Dr. Dangleben. Peace.